Dr. Toyo's here with a interesting case. This is a patient who has type 5 skin with rosacea. The misconception is patients with dark skin, either type 4, type 5, type 6, can have rosacea, but they can. So this patient, you can see in the picture up and to your left, you can see those small little abnormal blood vessels called telangiectasias in rosacea. Those telangiectasias secrete inflammatory mediators that break down the skin, but they also can break down the glands, the meibomian glands, and cause dry eye disease. Now, the reason why rosacea isn't diagnosed in many patients with darker skin is the epidermis is a little bit thicker, and you don't really see these telangiectasias on the cheek and nose. But with the slit lamp, our little microscope, and with the thinnest skin of the whole body being the lids, we can see these abnormal blood vessels. So this is why this patient was misdiagnosed. But not only does this patient have a rosacea of the skin, but they have ocular rosacea, where you can see actually blood vessels, because the inflammation and the inflammatory tear is so bad that they're starting to develop blood vessels on the cornea. So these blood vessels are abnormal. They're not supposed to be on the cornea, and they're delivering inflammatory mediators onto the cornea, which can cause some scar tissue. And that's what's going on with that whitish thing, little dot that you see in that picture down and to the left, that they're starting to get some scar tissue due to these abnormal blood vessels. Now, the other misconception is that you can't do intense pulse light on these patients. The technology has improved so much, and the protocols and parameters I have set up for intense pulse light for dry eye, we do have the ability to actually treat these patients with intense pulse light. But you have to be an experienced IPL treater to be able to actually do this kind of treatment. You have to get the parameters just right. This is why we have courses in intense pulse light and workshops, so I can train doctors on the parameters, protocols, and actually the theory behind treating this patient. Now, if you don't have intense pulse light, or you don't feel comfortable treating these patients, you could do low-level light treatment. Now, low-level light treatment will not close off these telangiectasias, but it will get some energy to the meibomian glands so that you can actually express these glands and get out that toothpaste-like secretion in these glands and get these glands making more of a normal tear. If you can get a normal tear, what will happen is that the inflammation will decrease, and these small little blood vessels on the cornea, these abnormal blood vessels on the cornea that are causing destruction, will slowly go away. Now, that process can take years to finally, for these blood vessels to regress. But you definitely want those blood vessels to regress, because not only will they cause scar tissue, if those blood vessels bleed, they can cause staining of the cornea. So the main thrust of this little video of mine is to say that just because a patient is darker skin, type 4, type 5, type 6 on the Fitzpatrick scale, don't miss out on the fact that they can have rosacea just like anybody else. It can cause meibomian gland dysfunction, and it can progress to ocular rosacea if you don't treat it.